Hello, my name is Dr. Esther Jones. I'm the Health Coordinator at Nueces County Community Action Agency. We're going to talk about our health forms and the Health and Safety Policy and Procedures Manual for this coming school year. Of course, we always like to start off with our mission statement, which states Nueces County Community Action Agency works with partners to apply comprehensive strategies to eliminate the causes of poverty for the people of Nueces County. Before we get started with the health forms, I do want to tell you about something new that we are doing this year for this coming school year. Several of our health forms that we had a paper copy of are now going to be found in Child Plus. At enrollment, most of these forms, several of these forms are completed during the enrollment process, which includes the Let Risk Questionnaire, the TB Questionnaire, the anemia consent form, and the lead consent form. These are found in Child Plus, and they will be completed at enrollment. Some other health forms that are going to be found in Child Plus is the anemia screening results, the childhood blood level report, the children's incident illness report, the children's incident illness supplemental report, and the referrals. You will have an additional in-service training by Christine Cifuentes regarding how to enter these forms into Child Plus, how to make them as attachments in Child Plus, and where you can find the tabs for these health forms. So this is a copy of our physical exam form. It is the same for the 2, 4, 6, 9, 12, 18, 24, 30, 3, 4, and 5-year-olds. The only thing that will change is, of course, where it says in the bottom 2 month on your screen, that will change to a 3-year, 4-year, 5-year, whatever the exam is going to be for that particular time. We'll accept computerized physicals from the different pediatrician's office, but this is the form that we have. We can fill out the top portion, give it to mom, tell her to take the child to the scheduled required physical exam appointment, and for them to return that exam once the child is seen by the doctor and we have the signed document. For those of you that are in early childhood, this is a form, the 18 Vision Developmental Milestones. These are for children from birth to the age of 1. This form is a little bit, it is not difficult, but it takes some time to fill this out. We used to have a 1-pager that half of the page was for vision, the bottom half was for hearing. That 1-pager has been replaced by this 17-page document. It is very comprehensive. At enrollment, the advocate will ask the parent, the guardian, these questions depending on the child's age. For example, this child is a month old. So at enrollment, the advocate will tell the parent what the milestones, what is the child supposed to be doing at this time, typically. Then she'll ask the questions that are concerning, is the child able to do these tasks according to the milestones. If the answer is yes, we check yes. If it's not yet, then in 6 weeks, we have to rescreen. We write the date on there. If the answer is no after the rescreening, then we will do a couple of things. One, we will refer the child to their pediatrician, or we will make a referral for the child to see a specialist. Most of the time we'll go to the pediatrician and the pediatrician feels that something else needs to occur, then that pediatrician may refer the child to a specialist. So we will do this for the child that is 1 month. There's the next milestone, maybe 2 to 3 months, 4 to 5 months, 6 months, whatever the age is, those are the questions that you're asked. Again, this is completed by the advocate at enrollment when the mother or the guardian is there with the child. After that, after the first assessment, the first questionnaire, then this form will be filed in the child's record. Once we put the child's name on the top, the date of birth, the age of the child, where it says in the bottom, home base, visitor nurse signature. You can draw one line through home-based visitor nurse and just put a teacher or assistant teacher, the advocate, whoever is doing it. The advocate will do it in enrollment. Subsequent questionnaire questions, questions will be asked, will be done by the teacher. So this questionnaire is available in Spanish and in English, the whole document. Now, whatever our results were on the first page, whether depending on the age of the child, those results will just be copied in the back pages. This happens to be page 10 of the document. So the results that you wrote or that the advocate wrote on page 2, then those results are written here. Now, what we need to remember that the first time the child is enrolled, the advocate will do it in enrollment. The form goes in the child's binder. Thereafter, the next milestone, according to this screen, it's when the child is between 2 and 3 months. So the teacher will say, okay, the advocate did it at 1 month. The child is now 2, 2.5. I'm going to go ahead and do the questionnaire for 2 to 3 months. You flip your pages, it'll probably be on page 3, and you ask those, no, you will see if the child is able to do them. The first assessment at enrollment by the advocate will ask the caregiver, the parent, if the child is able to do these things. After the child has been there for a month or 2, then you will be able to tell if the child is able to reach those milestones. And again, you go through the same thing. Yes, you check yes. If it's no, you put no. You have to reschedule a second questionnaire in 6 weeks. Write the date on there, come back and do it again. If he passes, yes, great. If he fails the second time, then you go to the right-hand side where it says next steps and either refer the child to the pediatrician or to a specialist, that sort of thing. The anemia screening results, we have a policy that our staff will check, the health staff will check to see if we have a consent. They will schedule a day for the screenings. They will post, and will tell the staff at the centers, we're going to be here during this time. They post that announcement. The staff will do the screenings. They will document the screening results in Child Plus. And therefore, your responsibility is just to see that this is actually entered in that anemia screening results tab. Christine will show you how to check on that. And Christine will cover that training in her Child Plus training for you. This is the asthma action plan. This is the IHCP. If the doctor says there's an asthma action plan attached, it's fine. He signs this form, and then he will give us an asthma action plan. This is quite acceptable to us. It may look like this. The doctor may have his own. There are some that are maybe 2 pages. Become very familiar with the asthma action plan, because more than likely, if the doctor has an asthma action plan, he's not going to fill out the IHCP, because everything that he wants done is listed in this plan. This is a form for the authorization for administration of medication. We have an IHCP that the doctor signs. It gives us the doctor's orders, what he wants us to do. Then we have to transfer that information to the very top section with the teacher, the advocate, the site-based manager, whoever is completing this form, with the parent. Make sure that all the boxes are filled in, the name of the child, the medication, the doctor, expiration date, possible side effects. All that top portion is completed with mom and the teacher or the health, one of the staff. Mom will sign it and date it. The middle portion of boxes, rows and columns. This is if the parent administers the medication at home, the first dose or the morning dose. Every morning we ask mom, did you give the child his medication? Yes, she did. She will put the date, the time, this dosage, and she will sign. Then when you're going to administer the medication, let's say at 12 noon, Then you remember to put the date, the time, the dosage. You check for the 5 R's, you sign, and the person that actually witnessed you doing all these things, you can ask her to co-sign that, yes, in fact, all of these things were done correctly. In the event that the medication is expired, or we have done the treatment for 5 days, like the doctor said, when we have to return the medication to mom, we give her the medication, we give her this form for her to sign, and that is it. You will also receive additional training on medication administration by Adriana. She will do her PowerPoint specifically about the medication form and how to administer medications. What we're doing now is just going through the forms. None of our health forms changed this year. The only change are those forms that are going to be in Child Plus as opposed to being a paper form. You're very familiar with your daily health check. Every morning when the child comes in, you want to make sure that he's healthy and ready to learn. What I used to do in the classroom, get at his level, eye to eye, in close proximity, so he will know that I'm talking to you. I want to know about you, what is going on, everything okay, any cuts, any bruises, any concerns that you have that you want to talk about, and you document this on here. This is our dental form. No changes to this form. Do the top portion, write the date, the child's name, and all those kinds of things. Fill it out of the top portion, give it to mom. Ask her to make an appointment or to keep the appointment with a dentist, and to bring this form once the child has had his dental examination and the doctor has signed. The diaper disposable training pants. This is the same form, no changes from last year. And again, Adriana will spend more time telling you about this form. All the forms that I'm showing to you, no changes this year. We have a policy, a procedure, and instructions on how to fill out all these forms. You will receive a copy of a flash drive with all the health forms, instructions, the policy, the procedures. It will include the performance standards number, why we have to do the forms that they ask us to do. The first aid Fanny pack, this also is the same form. We did not make any changes. If you run out of supplies for your first aid Fanny pack, and remember, there is a list of things that are required in your Fanny pack. If you are missing something, fill out this form, give it to your manager, and she will contact either Christine or one of the nurses. Will gather up the supplies and make arrangements for them to be picked up or to be delivered. No changes to this form. This is a medical dental service voucher. If we have a child that the doctor or the dentist, more than likely will be the physician, requires a certain equipment, a specialized plate, a spoon, a cup, a wedge, and let's say the insurance, mom's insurance or the baby's insurance does not cover it, or they do not have money to pay for this medical item, then they can give me a call, and I will look in the community with our resources to see if we can get one for free. After we have exhausted all our possible resources in the community, if no one is able to provide that, then we can fill out this form, and we will pay for whatever item the child needs. I have never had to do one of this form. We have very good community partners that they are able to help us meet the needs of the child. These are the health emergency procedures. It is listed in the policy procedures manual. It will tell you exactly what you need to do in case there's an emergency. If you need to do CPR, if you have to do first aid. What do we do if a child loses a tooth? It is very explanatory and tells you in detail what to do. It is quite lengthy, it's 6 pages. I wanted to let you know that it is in your flash drive. It will direct you what to do. It will also direct you on how to fill out the incident report that is now done also in Child Plus. And Christine will talk to you during her session on how to complete the incident illness report and also the incident illness supplemental report. All the same questions that are in the incident report are now in the electronic form in Child Plus. Procedures again on how to fill out the paperwork and where this new form is documented on, which is in Child Plus. This is a list of items that the health department carries. If you need some scissors or tweezers or thermometers, I imagine that because of our current pandemic situation, that we will not be using the thermometers, those little thermometers that we do the underarm temp taking. We will probably be using the touchless or touch-free instruments. The day that we close the program because of COVID-19, we did manage to make some orders for those thermometers. And I know that other people are working diligently to acquire all the materials and medical supplies that we need before school starts. I told you earlier that in order for us to administer medication, we need the doctor's order, an IHCP. We need the form that mom says, yes, I give you permission to administer the medication. And of course, we need the medication in a original container. If the doctor completes an IHCP and then wants to add another step, wants us to do something in addition, he will fill out this form. None of the doctors have ever used this form before. They just do this one, the IHCP. If he wants to change something, that he'll usually generate a new IHCP, DC1 treatment and start a new treatment, or to continue what we were doing before. This is IHCP. It's in our policy procedures manual. It is on the flash drive, and this is how the form is to be completed. The infant daily activity report, this is the same one that was generated by the education department. You will complete the form as instructed previously. Adriana is going to discuss this report in length with you when she does her training. Just a reminder, the form is the same as last year. There are no changes to this form. If we need a physical, a dental, screening results because we did not get consent from the parent or the guardian to do the screenings, then they need to bring us the blood results. If the advocate needs a more current insurance card, or if immunizations are coming up and we need to remind mom, this is the form we use. We tell her what we need and when we need it by. If it's a 4-year-old, if it's a physical, the child turns 3, 4, or 5, whatever the age of any child, a physical, we need it, we'd like to get it back. The child comes back to school. If he doesn't have the physical, the child is able to remain in school. The same for a dental. For immunizations, however, if we have given mom the reminder at 30 days, at 2 weeks, the week before, on Friday before they left for the weekend, we've done our reminders, and we explained to mom that we need the current immunization record on Monday. If we do not get a current immunization record on Monday, the child will not be able to remain in school. We very professionally, very politely remind mom that our policy says that a child must be current with all immunizations to remain in school. This is the form that the nurses use when they do the hearing screening. They will complete this form. They will enter the data into Child Plus, and this is filed in the child's record. This is the vision screening tool. Again, the nurses will do the screening. They will record the results, and this form is also filed in the child's folder. This is the hearing screen for the children 6 months through 3 years. The nurses will do the screening. They will enter the data. The form will be filed in the child's record. This is the parent advisory for any health issues, communicable disease that occurs in the school. Because of HIPAA, we will not tell a parent, we will not disclose the information to the family as to who is the child that has a confirmed case of a communicable disease. If we get a confirmation from a physician or an FNP, a PA, we have to get a confirmation from a healthcare provider. Once we receive that confirmation, they will give me a call or Christine. It used to be me. Christine is doing them now. She will complete this form, English and Spanish, return it to you. You post it, make sure that the parents know that the child may have been exposed to this communicable disease. We explain to them that they do not have the flu if they have concerns about that communicable disease, and if their child was infected, we can certainly suggest to the parent that they make an appointment with their physician. This is a sanitation log, no changes to this form. You write the date, the staff name, when we do the sanitizing of the cribs, the cots, the toys, and complete this form. This is the seizure action plan. Very recently, we have several children that have a seizure disorder. We have IHCP that the doctor prescribes to us what he wants us to do in the event a child gets a seizure. Most recently, I'm not sure, I know we had at least one, maybe two children that now have a seizure action plan. Again, it's similar to what the doctor tells us to do in case a child is having an asthma attack. There is an asthma action plan. This one is a seizure action plan. Will dictate to you exactly what you need to do at what time interval. There are written instructions on this. The form is new. We do not require it for every child that has a seizure. The doctor will determine whether he wants us to follow an action plan or just the IHCP. I believe last year that I was asked to write a policy regarding choosing the play area. We want to protect our little ones that are crawling on the floor. We always enter, we wash our hands, we put our booties, and if a family member comes with children, additional children or other visitors, we ask them to please not walk through the classroom, but to stay close to the door. The people that do actually walk in, they need to cover their feet with the booties that we provide for them. This is a policy regarding that. This is just a copy of the vision screening summary. This is what the girls do, the CMAs conduct. I just thought that you would like to see the actual form. It takes just a few seconds for this screening to occur. And the infant sleep exception, again, with our babies that are under the age of, that are still considered an infant, if the doctor says that the baby cannot sleep on his back or that he needs a wedge, any modifications to the baby sleeping on his back, we need to have a sleep exemption form that is filled out by the doctor, and he will explain to us what we need to do, why we need to do it. He will sign and the parent will sign, and therefore this one we can file also in the child's folder. And we will follow, of course, those doctor's orders. We have come to the end of our class with the exception of the agenda questions. The first question on your agenda, health staff has numerous health forms. And I believe we probably have 20 some forms. No changes this year. The only change is that some of the forms are now in Child Plus. So yes, we have numerous health forms. That is true. The next question, it is very important to complete all health forms accurately, completely in a timely timely manner. Of course, that is true. The health staff must be notified of all incidents, injuries, illnesses that require attention. Yes, please, that is true. An incident illness report is required on all incidents, injuries, and illness that require attention. Correct? True. A parent advisory is required if there is a confirmed case of a communicable disease. True. A teacher, an advocate, a site-based manager, or a health staff can complete a just a reminder. Correct? True. An IHCP signed by a physician is required before staff can administer a medication or treatment. True. And if a child is not healthy, he cannot learn. Very true.